Thank you, Molly. So, as mentioned earlier, we took a social determinants of health framework. So Jessica spoke to that, and we understand the need for that to really move towards health equity. Many of you have probably seen this image before. But essentially, understanding that social and economic factors and the environments we live in contribute substantially to health. So for the health impact assessment, we used a framework where we assessed and looked at community-level social and economic needs as part of the assessment. Issues around access to care. We know that's an issue. It came up last time, so we dove deeper into that as well. And then also health conditions and behaviors, so prioritized health needs related specifically to health conditions impacting the communities. Jessica showed this image before, so the hospital is also very interested in using the county health rankings framework, county roadmaps. And so this, in the most recent findings from the county health rankings, they rank health outcomes and health factors. And so out of 14 counties, you can see where each of the counties falls related to health outcomes and health factors. And really, again, just pointing out the largest percent amongst modifiable factors that impact health are social and economic factors. So really trying to think through that lens. So this image or figure illustrates our process for conducting the community health needs assessment. So as George had mentioned, many of the hospitals that are part of the coalition did needs assessments as part of that work with the coalition in 2013. So our goal was really to build off of that work and using existing data that in a variety of different areas, qualitative data. So we did some focus groups and key informant interviews. Collaborative Educational Services led those efforts. And other existing data. So we asked our community partners to share reports, assessments that had been done to really try and get an understanding at the local level what was going on. And then use that to come up with a preliminary list of prioritized community health needs. And then we did a series of listening sessions for each of the hospitals. And then based on that feedback, developed our reports. And as you can see, the steering committee, which Molly just spoke about, had input both into our process of how we conducted the assessment, but also in terms of even some of what we found, either through the participating in the listening sessions or direct feedback. So we did a community health needs assessment report for each of the coalition members, and then also which focused on their specific service area. So that's going to vary. And then also we're in the process of developing a regional executive summary. So this is a list of the prioritized health needs that came out across the region as a whole. In the top area are the community-level social and economic determinants of health. Below that are barriers to accessing quality health care, and then below that, the health and health behaviors, knowing that those things impact the health inequities and health conditions that we're seeing in the communities. So for the community-level determinants of health, lack of resources to meet basic needs came up as an issue across all of the communities. We know that people that are struggling to meet basic needs face a number of health challenges. Lack of transportation. So that came up particularly in barriers to accessing quality health care. That rose to the top in interviews we did across the region as a major issue. Also, food insecurity and food deserts, that came up across the region as well. So all of the counties, the 4 counties we focused on were Hamden, Hampshire, Franklin, and Berkshire. That came up as well. And then in some cases, in some of the counties or hospital service areas, issues arose to the top. So lack of community safety rose to the top in some instances in Hamden County. We know structural racism is an issue. We were using a data-driven approach, so in some of the reports it rose to the top because of the disparities and inequities that we're seeing, and then also because it came out in some of the data that we were gathering in focus groups and interviews. Barriers to accessing quality health care. Again, I mentioned lack of transportation came out resoundingly as a need. Other needs were limited availability of providers, and that varied across the different regions. There were some that were cross-cutting. So, for example, mental health and substance use, that was cross-cutting the need for more providers. And then challenges with accessing across the systems because they were siloed. So that was an issue as well. Lack of care coordination came up across all of the regions, and then some insurance-related challenges. So an example would be that related to those on mass health and mental health and substance use, if people miss 3 appointments for mental health, and we know there are a number of barriers to actually getting to those appointments, then they need to go back to their case manager and have the case reopened. So that's an example of that. And then in terms of the health and health behaviors that were identified as prioritized health needs across the region, chronic health conditions, so obesity, diabetes, cardiovascular disease, asthma, COPD, chronic obstructive pulmonary disease. So in some cases, it varied across the region. So, for example, in Hampden County, asthma was a concern in general, and there were health inequities, whereas in Hampshire County, pediatric asthma was more rose to the top, along with some of the health inequities related to asthma. The need for increased physical activity and healthy diet came out across all the regions, Mental health and substance use, so that rose to the top in all of our interviews with public health providers across the region, a particular concern around the opioid epidemic, and then also mental health concerns as well, which you'll hear some of the great work going on in the region when we move into the best practices to address this. We also saw inequities as well that arose related to these areas. For example, so some of the youth substance use, you'll hear some of the work around. And then also one of the things, an example that came up is that looking at the surveys across the region that were done amongst youth, depression came up, but then particularly depression amongst the LGBTQ youth, where it was approximately 50% across all of the data we had for 3 counties. So there are some areas where we definitely identified vulnerable populations. Infant and perinatal health risk factors, so that includes prenatal care, and then also smoking during pregnancy, again, some variation across the region, and then sexual health, which relates to teen pregnancy and sexually transmitted infections, and again, some variation across the counties. You'll find more detail about these findings in each of the hospital reports, but then also with the regional executive summary that hospitals will be releasing. We also identified a number of vulnerable populations, which Gail is going to speak to. I'm going to turn it over to her now. So one of the interests of the coalition was that they were really interested in actionable information. So we did the focus groups and interviews, which really provided us with more of that. So Gail's going to speak to some of what came out of the focus groups and interviews.
Turn that up. Good morning, everybody. Hope your coffee is still holding out. I know we've been sitting for a while. I want first to give a shout out to my colleagues at Community Health Solutions and the Research and Evaluation Department at the Collaborative for Educational Services, who helped us to plan, conduct, in collaboration with the coalition and partners, plan and conduct the interviews and the focus groups. And also, as I look around the room, I know that many of you yourselves were interviewed or a part of focus groups and participated. So some of these findings are a reflection of the kinds of things that people here in our own region told us, many of which may not surprise you necessarily, but we felt that it was really important to hear directly from individuals in our region, along with looking at other data sources. So as you look at the menu there of the kinds of vulnerable populations that were identified, as Kathleen mentioned too, we're looking, each of the hospitals as well as region-wide, we're now looking at what are some of the key concerns of these groups, what health issues, and how does that help inform and shape community health improvement plans, which individual hospitals and their partners are looking at, but also we are beginning to look at on a county-wide basis, so back to those county health rankings. So again, some of those groups that you can see there, I would point out a couple of things that I think are interesting and that, again, you may be very well aware of. Issues of poverty in Western Massachusetts may look very different in an urban area versus a rural area, although for both of those, we continue to hear about lack of transportation and concerns, despite whichever kind of neighborhood you might be living in. Some of the coalition members wanted to specifically look at some groups like veterans and even digging more deeply to think about the differences and similarities between older veterans, the Korean War, World War II, Vietnam era veterans, versus the post 9/11 veterans who tend to be younger. So that, again, even looking at some of these groups in a more detailed way, looking at LGBTQ issues, again, for adults, for young people, particularly around their specific health concerns and needs. So all of this will be used to further shape improvement plans and also to recognize that there is such stigma attached to mental health and substance use that those individuals can be seen regardless of their race, ethnicity, economics, some of the other demographic factors. Those individuals can be vulnerable just based on their mental health and substance use issues. So we wanted to be sure to dig more deeply into that as well. Again, many of these may not be super surprising to those of you in the field in terms of looking at what do our elders need, what are some of the detriments to their health. Again, as I mentioned, culture is much broader than just race or ethnicity. Looking at our veterans, across the board, and again, many of our even rural communities are experiencing new arrivals in their community for whom English is not their first language. So it's not just an urban phenomenon. But again, what are the needs for interpreters, materials, bilingual providers, health education tools that are more readable and accessible, again, across the board? This is what we heard from both providers and consumers. Heard a lot about how we have work to do in our region to help our healthcare providers be more knowledgeable and skillful and understanding about LGBTQ issues, health needs, and how to really provide that care in more culturally competent ways. And I know many of the partners and the hospitals are taking a very close look at that, from simple things to, how are your forms written? What are the pronouns used? How are your restrooms made available and accessible? The kinds of things. How about reproductive health care needs across that spectrum? So those were some things we heard. We also heard a lot about trauma, substance use, violence issues, some of that. And then again, as was mentioned, this overlay of poverty, issues around economics, and those social determinants of health. And one of the, at the bottom there, I thought a very keen insight from one of our interviewees that the opioid abuse crisis has really shined a light on how fragmented our system of care is. Mental health, substance use, physical health, even mentioned earlier, oral health. It's like we separate the head from the rest of the body, and people have to really deal with a very fragmented system. So we heard about that as well. So more to come in terms of how this all gets acted on. And again, thank you to all of you who participated in giving us this kind of insight. Turn it back over to you. Thank you very much.